In recognition of Blood Cancer Awareness Month, we are pleased to welcome you to Blood Cancer Explained, hosted by AbbVie.
Hello, my name is Ilke Lamanju. I'm the Director of U.S. Oncology Public Affairs for AbbVie. Nearly everyone has been touched by cancer, either directly or through family and friends. What many may not know is that cancer can take different forms depending on where it originates in the body. And while an initial reaction to a cancer diagnosis may feel grim, tremendous research and treatment innovations that move beyond chemotherapy, particularly in a cancer that originates in the blood. In today's roundtable discussion, we will explore the complexities of blood cancers, what you need to know about risk factors, diagnosis, and treatment, and what the medical and advocacy communities can do to support patients and their loved ones.
Thank you so much for having me. My name is Alexis Gepner, and I'm a PA specializing in leukemia at a large academic medical center in Houston, Texas. I've been in practice for 11 years, and I can't believe this. I'm also an active member of APSHO, the Advanced Practitioner Society for Hematology and Oncology, and our mission is to improve the quality of care for patients with cancer by supporting critical issues in education, clinical, and professional development for advanced practitioners in hematology and oncology.
Hi, I'm Michelle Raja. Thank you for having me. I'm the Associate Director of the Information Resource Center at the Leukemia Lymphoma Society, and I've been there for 17 years. It's the part of the Leukemia Lymphoma Society where you can call if you're a caregiver, a patient, anybody who wants disease information, support resources, clinical trial searches, pretty much anything that you need if you or your loved one's been diagnosed with a blood cancer.
Hello, and thank you for having me here today. I am a global development leader here at AbbVie for almost 2 years. I am a physician by training, and I am dedicated for a couple of decades now for research and development of cancer treatment.
Mariana, first question is for you. So we have folks on the line here who are learning about what is a blood cancer, maybe for the first time. Can you tell us in very simple terms, what is a blood cancer and how is it different from a solid tumor cancer?
Cancer can affect any part of the body, including the blood. So for many people, when we mention the word cancer, they usually imagine a lump or a tumor in a specific organ or a part of the body that you're actually able to feel by hand. But the fact is, cancer can live all over the body. They can be found in our bloodstream or hide in our lymphatic system. So when we talk about the blood cancer, we usually talk about leukemias, lymphomas, and myeloma. So leukemia affects the blood and the bone marrow. Lymphoma starts in the immune system and affects the lymph nodes and lymphocytes, a type of white blood cell. Myeloma is, on the other hand, a cancer of the plasma cells, which are also a type of lymphocytes that make antibodies to protect against infections. They are all forms of blood cancer, but they affect the body in different ways. So it is important to understand that different types of blood cancer have different treatment options and that the prognosis can be different as well.
So blood cancers are roughly 10% of all cancers in the US. And compared to solid tumors, like Mariana had stated, it may seem like it's a rare diagnosis because you're not going to see as many commercials or ads supporting these type of cancers like you do with breast or prostate or even lung cancer. So one difference is the symptoms. So some blood cancers may cause symptoms such as fatigue, weight loss, sometimes easy bleeding, night sweats, and swelling of the lymph nodes that she had brought up, while others might not show symptoms at all. So some of them will show up abruptly, while others will develop over time. And some patients don't even have symptoms when they come in. So it's very important that patients, or any of us actually, go to our annual visits with primary care providers and have blood work at least once a year.
Yeah, it's incredibly important, definitely, to be in regular contact with your healthcare provider and to get that early diagnosis. Mariana, as a physician, help us understand how is a blood cancer typically treated and how is that different from a solid tumor type of cancer treatment?
Common treatments for blood cancer include chemo and radiotherapy, targeted therapies, stem cell transplantation, and immunotherapy. And even though treatments for blood cancer have vastly improved over the last several decades, still there remains a high unmet need to improve survival and quality of life of the patients with certain types of blood cancer. So for some patients, part of their treatment care could be delivered by participation in clinical trial. And by participating, patients play a major role in the development, research, and innovation process that can lead to new therapies and treatment standards.
The difference between blood and blood cancers and solid tumors, where if you have a solid tumor, you often try to surgically remove it, just like she was talking about. And patients will come in thinking, well, can I surgically remove this? And the difference between a solid tumor and a liquid tumor, at least one difference, is the patients are wondering if they have metastases. Like, has my disease spread? And the thing about blood is it's already everywhere. Treatment differs so much, one, because of that, and two, depending on when the patient comes in.
Recognizing the complexity of a blood cancer, what might be some of the key messages you would deliver to somebody in need who is starting on a blood cancer journey?
Yeah, so as we've been talking about, blood cancer is complex. It's not just one type of cancer. And the most important thing is really to find out, what do you have? So that's one of the first things when someone calls us. A lot of times they said, my doctor told me to call you. I don't even really know where to start. So the first thing we try to find out is, okay, what is your diagnosis? And really getting down to, okay, you have a lymphoma, but which type of lymphoma? Oh, I have non-Hodgkin. Okay, I have a B cell. Okay, but what subtype? Because all of that information is going to be so important for you to know exactly what it is to expect, what your treatment's going to look like, if you're going to get treatment or not, what kind of side effects you may have. Anything that you're going to need to know is so important to have that exact diagnosis.
Your first visit with the care team is going to have a lot of information, and I often tell my patients that too. You're not going to remember everything that happened in this visit, and it's normal to forget a lot of things that you're going to learn in this visit too. So one thing is just to be sure you're given a way to contact your care team with questions, because they're going to come up after the visit. It's inevitable. And often when you get home, or 3 o'clock in the morning when you finally think of something. So I often recommend that patients bring with them questions to their visit. If it's something we don't know, we'll help them find out the answer to that question. Also jot down some important information that you obtain in your visits. And then once you get home, you can go over it with your family members and your friends, and then you can ask your care team afterwards. Think of yourself as a survivor the day you're diagnosed. You're not a cancer patient, you're a person who has been diagnosed with cancer. And we're here to help you with that journey. We don't expect you to do this alone.
I just want to add something, right, which I think it is important for patients to understand, and that is that every type of blood cancer is different, right? And it has different treatment options, and also the prognosis can be very different, right, as well. I will just give an example, right? Diffuse large B-cell lymphoma, which is the most common type of non-Hodgkin lymphoma, it is also an aggressive disease. However, approximately 2/3 of all newly diagnosed patients can be cured. So I think that is very important information to have once you find out actually that you have a blood cancer.
Michelle, any additional information you'd like to offer? I know that you speak to patients and caregivers every day at the LLS. What are the couple of things that you always remind someone of once they've been diagnosed with a blood cancer? What might be some of the common things you share with them, or reminders?
We talked about having questions for your healthcare team. Sometimes people don't even know what to ask, so we can help you. We can try to figure out with you, okay, what are the top 3 things that you need to find out or talk to your doctor about, so you can make educated decisions and really understand what it is that you or your loved one is dealing with. Because knowledge really is power, and you can't make decisions if you don't even know what you're deciding on a lot of times. The other part is getting a second opinion. Blood cancers are complex, and it has no reflection on your doctor. It has no reflection on where you're getting care. It really is a wise thing to do to just have another healthcare professional who specializes this as well look at your lab work, look at your scans, look at any biopsies that have been done, and just to confirm that you're on the right path and you know what to do, especially if you're going for treatment. If you're at a point where you haven't had to have treatment and you need to go to treatment now, you want to know what all your options are. Clinical trials, we talked a little bit about that and how important that can be. And it's not a last option, which is what a lot of people think. You really can consider a clinical trial from the beginning if it's something that you want to look into as a possible treatment option that may not be available otherwise. And get support. Get support from other people who've been through it, who know what you're going through. Get support from your family. Get support from professionals, from counselors, social workers, whoever it is, because the more support you have, the easier, not that it's going to be easier, but the easier it will be for you to be able to figure out what it is that you're dealing with and how do you get to where you need to be through all of this.
Thank you. And as you said, knowledge is definitely power for all of the panelists. Unmet needs still remain for those living with a blood cancer. So from your perspective, what do you feel particularly passionate about when you think about blood cancer research or treatment innovation?
There's not as much mainstream focus in the treatment of blood cancers as much as solid tumors. And there's no screening tools. So if you think about screening tools for solid tumors, you have mammography or mammograms for breast cancer. And you go in, you have maybe a chest x-ray or CT scan for lung cancer, but there's really no screening tools for blood cancers. So as simple as a blood draw is, patients don't get them as often. But this is the best way to figure out what is going on, if there is something going on. And it goes back to the fact that we don't have any screening tools for this.
So I will take a little bit more general approach. So significant advances in the treatment of blood cancers has enabled patients with certain types of blood cancer to actually get cured. And also some patients, they are being successfully treated, meaning they're experiencing long periods with their disease is under control. However, there is still a critical unmet need for patients with rare or difficult to treat blood cancers or patients who have exhausted all available treatment options. Furthermore, for patients who progressed after frontline or several lines of treatment, there is still a need, right, to improve survival while having a good quality of life.
Michelle, you're often the person on the front line, speaking to a patient or a caregiver who's just been recently diagnosed or on a new blood cancer journey. And you're the very first voice they hear at the LLS. And from your perspective, what are the unmet needs that you see still for blood cancer patients and the blood cancer community?
Yeah, I think the biggest thing is when I talk to someone who has been diagnosed for years and didn't know we existed or other resources existed and we're trying to go it alone, that's very frustrating for me because I know that there's so many things out there that could help them and educate them and support them and give them potentially other options to learn about their disease. And just making sure that the word is out there that there is the support and the information and that patients really do need to understand their diagnosis in order to work with their healthcare team to get the best care, to make the best decisions for what their treatment journey is going to look like. Because for a lot of these patients, and a lot of patients who are going through this, who have a more chronic form of a blood cancer, they're going to be living with this hopefully a very long time. And they're going to need to understand their disease. They're going to need the support to keep going and find a way to live a full life despite the fact that they have a blood cancer, and that it's quite possible. With all the advances that have been happening, especially recently with blood cancer treatment and research.
Mariana, again, you're a physician and you've had firsthand experience in understanding really what a patient's journey is like once they're diagnosed with a blood cancer. Compared to 20 years ago, there's so much more to be able to offer a blood cancer patient today. But talk to us about what more you would want to be able to offer a blood cancer patient in terms of research effort, or most importantly, a treatment option. What are some of those new additional advances that you would be hopeful for?
The truth is, in the past, people diagnosed with blood cancers really didn't have many treatment options. Basically, chemo and radiotherapy were the only options they had. So the amount of research on blood cancers has literally doubled in the past decade. There are tremendous research and treatment innovations that bring significantly better outcomes than what we really had before. I will just give you one example. In past, chronic myeloid leukemia was considered a deadly disease. Before, when we didn't have the targeted therapy, the 5-year survival rate for people with chronic myeloid leukemia was only 22%. Today, the overall 5-year survival rate is 90%, which makes a huge difference for those patients. New treatment modalities are being developed to address unmet needs for patients with rare or difficult to treat blood cancers, or for patients who have exhausted all available treatment options. Today, we have promising therapies, including immunotherapies, chemo-free regimens, multi-drug combinations, chimeric antigen receptor or so-called CAR T-cell therapy, bispecific antibodies, and so on. So ultimately, as with all other cancers, our goal is to cure blood cancer. And also at the same time, we are looking for an option to extend the time patients with this disease can live while having a good quality of life.
Even within the same diagnosis, you may not have the same situation as somebody else. So even if you know somebody with the same diagnosis, their prognosis or their treatment protocol may look very different from yours because of the fact that we know so much more now on a molecular level that it really is individualized. So you can't just say, oh, well, my neighbor has this or my cousin had this, or it's all going to be very different. And it really is important for you to know for you with your doctor and your healthcare team, what does that mean for you? Not just for everybody or anybody else who has this diagnosis.
Are there any other key messages or resources that you would really like for a blood cancer patient or their caregiver to know about?
In the last decade, 52 new drugs were approved by the FDA for the treatment of blood cancers, and that's just in the last decade. So if patients understand, how quickly things are happening, and things don't happen quickly, unfortunately, in cancer and cancer research, but the researchers in the field of oncology or the field of cancer are working so hard and making so many strides that our patients have a lot more options than they used to. And we're treating many types of cancers, even the chronic types of cancers, and that's one of the main goals, is to have a patient be able to live a normal life, be able to do the things that they want to do. We're not just treating numbers, we're treating the numbers so that the patient can do what they need to do. So I think that's an important thing to bring up.
Great. Yeah, Alexis and AbbVie, sometimes we call those moments, bringing back the magic of normal, and what it means to have a normal moment and how special that is, and how you can forget about that normal moment when you've been diagnosed with something like a cancer. So thank you very much for that. Mariana.
What I would like for patients with blood cancer to understand is that we at AbbVie are fully committed to advance discovery, innovation, and care for people with blood cancers. And we are, every day here, we are diligently working in order to develop treatments for patients with blood cancer, including those patients with blood cancers that are very difficult to treat or patients who have no other options available with current treatments.
One, you don't have to go through this alone. There's a lot of support out there. There's a lot of organizations like the Leukemia and Lymphoma Society who want to help you and help you understand what you have and give you the support that you need. The second thing, like we've been talking about with, is clinical trials and how important they are, and how the reason that we are making so many advances in blood cancer research right now is because so many people have been willing to go into clinical trials. And if it's something that you'd be interested in, we do have a clinical trials team of oncology nurses who can help you see what options are out there. And not that we'll tell you what trial to go into, but it will give you something to go back to your hematologist oncologist with and say, are any of these a possible option for me? Is this something I can consider? And there's a lot going on in blood cancer research, thankfully, but we still, like we've been talking, there's a long way to go. So the hope is that we will get there sooner rather than later.
To all of our panel members, why did you decide to pursue a career in oncology? What are your personal and professional reasons for really being so committed to oncology care?
I used to work in the laboratory, and I did that for about 4 years. And so I got to know what kind of cells were underneath the microscope. And I was able to be transferred into the cancer center where I worked at the time, and when I was working in New York. And I got to know all of the patients and just getting in touch with the patients, understanding what they were going through, understanding how much each person's job in oncology or in cancer, in blood cancer research, in blood cancer treatment was so important to the patient. I was able to become a bone marrow tech as well. So I almost felt like I was cheating when I got into my career as a PA because I had so much knowledge from that. But really getting to know the patients, understanding their backgrounds. The thing about blood cancers is that, unfortunately, of course, in the beginning, we see our patients a lot more often than you would see a primary care provider. But that also gives you the ability to really learn about your patients, learn about their backgrounds, what their families like, how they're feeling, and they get more comfortable speaking with you. And you're able to develop a real relationship with these patients. And you have this passion for it, or at least I feel like I have a passion for it. Just learning about not only the disease, which has vast changes in treatment options because of the amazing work that our researchers do, the clinical trials that everybody has mentioned have really improved the treatment options for our patients, and just seeing how patients do. It's really remarkable. It's a remarkable field, and it's just remarkable to see how much change has happened just being in this field.
So my answer is a little bit personal. I was raised with very passionate scientist, oncologist, my dad, who was my role model almost since I can remember myself. And I always had this wish to be an oncologist, to help patients and to potentially change their lives. And so this is something that still keeps me going, that wakes me up, when I wake up in the morning. This is something that I really think about. And also in the evening, when I think about my day, what I did that day really kind of fulfills me and makes me happy, because I really know that we make a huge difference for cancer patients, and that actually, in a way, I am living my dream.
So when I answered the ad for the information specialist position, I was looking to learn something new, and I knew nothing about blood cancer. And I didn't know how much I didn't know about blood cancer until I got into the position. But it was amazing to just go through and understand how complex it is and how there's so much to know. So every time I talk to someone on the phone who either has been diagnosed or has a loved one, I can go back to that feeling overwhelmed of, oh my gosh, I don't know what I don't know, and how important it is to really understand what it is that you have and why, and how it gives you more of a sense of understanding and just more peace to know, okay, I'm not completely overwhelmed because I know where I have to go or who I need to talk to or what I need to do next. And every time even after all of this time, I get to talk to someone on the phone or however, through an email or whatever it may be, just getting those thank yous back, or somebody saying, thank you just for listening, or just helping me understand a little bit better. I really was confused, or I didn't even know where to go next. And knowing that I was able to give them those next steps to help them get where they need to be is just rewarding every day.
We know that September is Blood Cancer Awareness Month, and for those of us who are engaged in the blood cancer community, it's really an opportunity for people to understand this type of cancer and to also be aware of information and resources available for those who are diagnosed with a blood cancer or their caregiver. So are there any particular resources or support groups that you would like people to be aware of during the month of September, Blood Cancer Awareness Month, and throughout the year?
Sure. As we've been talking about, resources and support are huge and very important with blood cancer. At the Leukemia and Lymphoma Society, we have a lot of different options for both. We have, through our support, we have local regions throughout the United States and Canada that patients and caregivers can reach out to and get involved in whatever might be going on in their local area. A lot of our support groups are still on Zoom because we know a lot of blood cancer patients still have concerns with COVID and a lot of, being immunocompromised. So we want to make sure that they get the support that they need despite maybe not being able to go anywhere, or they may be in treatment. We have online groups that they can go to that are moderated by social workers. We have a First Connection program where they can talk to other blood cancer survivors and just talk to someone who can relate to what they're going through and just get some support that way. We have a lot of ways to get information. We have booklets, we have webcasts, we have podcasts, you pretty much name it. We can find a way for you to get some information about what you need to know and find something that's relatable. The other way to do that is to reach out to the Leukemia Lymphoma Society, and you can reach us at www.lls.org.
Well, Michelle, we're certainly very appreciative of organizations like the LLS and Alexa's APSHO as well that help provide information and resources to patient caregivers and also the healthcare community. Well, I hope you found the conversation with the blood cancer experts we've convened to truly be useful and informational to you. At AbbVie, we are creating a company that is making transformative discoveries and meaningful impact for people living with blood cancers. Through our pipeline and partnerships, we are adding depth and breadth to our oncology portfolio, all with the goal of continuing to set new standards of care for multiple forms of blood cancer and those that really have significant unmet need today. To learn more about what is a blood cancer and to learn more about blood cancer research that is happening today, please go visit AbbVie.com.
Thank you for listening today. This concludes our Blood Cancer Explained panel series. We would like to thank our esteemed panelists for their participation. As a reminder, please note the educational content of this video is not intended to be taken as medical advice and should not replace the recommendations and advice of your doctor. Please take a moment to review the disclaimer displayed on your screen. For more information, please visit www.abbvie.com. Thank you again for joining us.